Hi everyone, I would love to discuss a lumbar fusion surgery and why it's necessary in my personal opinion. My name is Jānis Slezins, I'm a board certified neurosurgeon. I am practicing here in Riga, Latvia, and today I want to share my personal view on lumbar fusion surgery. I have to say up front that I am not really liking spinal fusion surgery for some of the reasons which I will share with you today. What is lumbar fusion surgery? It makes at least two vertebrae fuse together. Spine consists of separate vertebrae and they are all moving in between each of other. Gives us a possibility to bend forwards or backwards or bend sideways to one side or to the other side. This is because of the movement. If we make two vertebrae fuse together, we lose ability to move in that one particular segment which is fused. And by fusing at least one segment together, we are at least doubling the load to the adjacent level. And making it wear and tear off faster. This is called adjacent level disease. If there is one segment which is fused together, the adjacent or next level to the fused one has more load on it and it wears off much faster, and that's why many of the patients after lumbar fusion surgery couple of years later end up having another lumbar fusion surgery when the fusion is extended to the next adjacent level because it has weared off. And then the process starts from the beginning with another next level. There are also lots of patients who had a lumbar fusion surgery for one or the other reason and they are not exactly happy. So I have seen loads of these patients coming to me after having fusion surgery somewhere else and still having lots of pain. The surgery seems to be fine, so X-rays are completely fine, all the pedicle screws, implants are in place, there is no surgical problems, but they are not happy. So those two are the main reasons why I personally, working with my patients, try to avoid fusion surgery as much as I can, because it doesn't make patients happy in most of the time, and it can cause some severe problems later down the line. But by saying that, I'm not saying that spinal fusion surgery is not necessary or it doesn't have a place. It definitely has a place, and it has, in my personal opinion, of course, there are many spinal surgeons who may have different opinion to mine, so I'm sharing only my opinion. So the spinal fusion surgery has its place definitely, and that place is instability. And just to give you an example, in 2 weeks time I will have a patient, a 50-year-old woman, traveling from abroad to have a lumbar fusion surgery here with us in Riga, Latvia. And this woman is having a true instability, so pain, which is developed as a result of excessive movement in between two vertebrae. And this patient has had lots of conservative treatment, including injections, physiotherapy, bracing, medication, etc., 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 for many years, and nothing has helped. This patient does not have a lumbar stenosis, so she is a purely low back pain patient, and she's having low back pain as a result of instability. So in this case, she is a straightforward patient for lumbar fusion surgery because we need to treat this instability that is causing her life to be miserable. Instability means that spine is not exactly stable, so that there is excessive, pathological, not normal, too much movement in between two vertebrae. And this movement is causing pain. So this is called lumbar, for example, lumbar instability, because lumbar spine is the most fused region in spine. And this lumbar instability can cause mechanical low back pain. So mechanical low back pain means that there is some pain that is produced because of this movement. And if we approach this logically with common sense, we can understand that if there is excessive movement that is producing a lot of pain, we can indeed use a lumbar fusion surgery to fuse these two together so they are not moving anymore in between each other and not producing pain. Also, there are situations when there is some instability together with a lumbar stenosis, basically the narrowing of the spinal canal. In that case, if there is a lumbar stenosis combined with instability, lumbar fusion surgery can be justified. And vice versa. If there is just a lumbar stenosis without any evidence of instability, which is a very common scenario, that there is a lumbar stenosis but there is no evidence of instability. So basically there is a narrowing of the spinal canal, and but at the same time there is no clear evidence of too much movement. We can offer patients minimally invasive surgery, because in my personal opinion, lumbar fusion surgery is not justified in that scenario. So we can offer patients minimally invasive surgery just to make spinal canal more narrow and decompress or provide relief to the squeezed nerves in the spinal canal. Of course, one of the possible complications of decompression surgery, minimally invasive surgery, by the way, we are doing minimally invasive surgery by preserving so-called facet joints. Facet joints are joints in between two vertebral bodies which are providing stability. Lumbar decompression surgery, as we practice it, is done under microscope magnification in microsurgical technique, and also we preserve facet joints, therefore preserving stability. However, there is a slight chance of development of instability as a result of lumbar decompression surgery, and then if it indeed happens, we can offer patients fusion surgery, but it's almost impossible to do vice versa. For example, if we start with spinal fusion surgery and decompression, and we find out that patient is in a lot of pain after this kind of surgery, it becomes extremely risky to remove metalwork after surgery. But if we have done decompression as the first step, there is always a possibility to add another step to do a lumbar fusion if it's really necessary. But it's almost impossible to do other way around. Thank you for watching this video. I hope you enjoyed. I wanted to share my personal view on lumbar fusion surgery and its place in modern spinal surgery. Please subscribe to our channel, hit the like button, and please see for our contacts in description. Thank you.